Today, I will be talking about use disorder. This condition is part of substance-related and addictive disorders category in DSM-5. Alcohol affects millions of people around the world and can seriously harm one's health, emotions, relationships. In this presentation, we will look at what alcohol disorder is, the biological and cognitive perspectives explain it, and how we treat and think about it. Alcohol is one of the most widely accessible drugs in the world. At low doses, it allows people to feel more confident and relaxed. At higher doses, it can make people feel lethargic, become more depressed, affect sleep, or even cause confusion. Alcohol use disorder is not just a person having alcoholic beverage every once in a while. It is when a person is in the gets drinking gets in the way and affects their life, whether at home, work, or in terms of their own health. The DSM-5 states that a person must show at least two of the 11 signs within a year. Some of these signs includes cravings, withdrawal, or failed attempts to quit drinking alcohol. Over time, alcohol can change how the brain works. When continuing these signs, the levels of alcohol use disorder are classified as mild, moderate, or severe. Looking at the biological perspective, there are different ways in how alcohol use disorder originates. The biological perspective explores the connections between genetics and brain chemistry. At the root of most substance abuse disorders is the brain. With all drugs, including alcohol, the brain's reward system is altered. Dopamine, which is the brain's feel-good neurotransmitter, makes drinking feel good and hard to stop. When the brain does not constantly receive this influx of dopamine, it can compensate, making the person feel lethargic, depressed, or unmotivated, symptoms that align with the withdrawal. Furthermore, with the biological perspective, alcohol use disorder, when we look at alcohol use disorder in biology, is genetics. Your sex can play a large role in alcohol abuse disorder. According to Nolan Hoeska, and Jennings, males are more likely to develop an alcohol abuse disorder than females. Men by nature are physically larger than women and usually have to drink more alcohol before they feel intoxicated, which can affect how much alcohol they can consume. Another biological factor tied to alcohol use disorder is age. The instances of alcohol use disorder decrease with age. As we age, the liver metabolizes alcohol more slowly, and alcohol is more easily absorbed in the system. This means older adults can become intoxicated more quickly and feel the negative effects of alcohol faster and for longer periods of time. Whether it's because of these effects or more developed frontal lobe with more life experience, older people tend to show fewer instances of alcohol use disorder. Another perspective that explores alcohol use disorder is the cognitive influence. The cognitive perspective focuses on how we think. Some people start drinking because they believe that it will help them manage their stress or make social situations easier. These thoughts, even if not true, can lead to unhealthy drinking habits that are hard to break. Those that suffer from alcohol use disorder often prioritize short-term benefits over long-term consequences, which can ultimately affect a person's longevity and ability to recover. This perspective takes into account subjective ideas and thoughts that influence behavior, such as personal beliefs, expectations, and learned associations about alcohol, all of which shape how individuals respond to drinking situations. One approach to treating those that suffer from alcohol use disorder is cognitive behavioral therapy. Cognitive behavioral therapy is one of the most widely accepted and acknowledged evidence-based approaches for those suffering from alcohol use disorder. It helps people understand their thinking patterns and change their behavior. Cognitive behavioral therapy helps people spot their triggers, handle stress, and build better habits without alcohol. This gives people tools they can use in their daily lives even after treatment ends. Another common treatment for alcohol abuse disorder is antidepressant medication, which can reduce anxiety and depression. However, the effect of this treatment has not been consistently supported without the use of psychotherapy. Another well-known treatment for those dealing with alcohol-related problems is Alcoholics Anonymous. This organization allows people to gain moral and social support, which can help change their perspective towards themselves. While this is a popular treatment for alcohol use disorder, its effectiveness has it's some mixed reviews. Although people tend to relapse, it still offers a path, an accessible path for treatment. When I look at both perspectives, I think both are important when we look at comparing alcohol use disorder, but I think the cognitive perspective offers a more holistic approach when it comes to understanding symptoms and offering a solution in the form of cognitive behavioral therapy. The cognitive approach acknowledges biological factors more deeply, while people pursue short-term rewards and lack understanding of their self-control, which can lead to addiction. One more thing that the cognitive behavior or perspective does is it also acknowledges the biological influences, but then it gives a reason why they're influenced or what they mean. One major issue with alcohol use disorder is people and the stigma. People often judge those with alcohol problems, thinking they're weak or choosing to be that way. This makes it hard for people to get the help that they need and can lead to more drinking, isolation, and shame. It's a serious barrier to recovery. One thing we can do to help this problem is to improve education and understanding of alcohol use disorder, especially on campuses, college campuses, where alcohol use disorders tend to begin or increase. We need to create a culture that supports, respects people who are working to get better, especially individuals of different races who are less likely to seek treatment than white Americans. And that's it. The resources are right there.